Hi, welcome, it's me, Dr. Khaled Sadek, and you're watching my fantastic YouTube channel on cysts and lipo removal. In today's clip, I'm going to revisit one of last week's clips. That's the Oxford cyst that we did. Now you may remember, this was a large, quite bruised cyst that I excised and drained and irrigated. We'll look through the video and we'll talk through it. But most importantly, a lot of people want to see what it looked like post-surgery. So we've added new material to show you what this procedure looked like. So it's just draining now actually. And it's this chocolate coloured discharge, which is basically pus, blood mixed together. So let's begin by talking our way through the clip and seeing what we see. Straight away, you can see it's very much this chocolate coloured substance. You remember that it was quite a large cyst, around 5 centimetres in size, and you can blot it between my fingers. Just get a bit more access into that. Okay, so there's a bit more stuff coming out there, okay? So there's a large volume collection there, okay? Let's try and just empty that all out. You can see some of the debris from the original cyst coming through there as well. Okay. Hubby's come over to have a look. This makes it a bit bigger actually. Sorry, you okay?
Yeah, it's a bit pressure.
Yeah, there's a bit of pressure. But you know, this thing is very, very deep. Okay, I'm just going to give another pressure to get this stuff out, okay? It's another kind of endingness, isn't it? There's tons and tons. The important thing to remember about infections is that the adrenaline and the xylocaine don't work so well, so anesthetic range that's provided is somewhat limited, and those of you that have had surgery performed on an infected cyst will know that it's much more uncomfortable than if it wasn't. So this is something to of course note. As we mentioned. Okay, so really next step is to see if we can get hold of this dissolve. Once the cyst has broken down and liquefied, it's very difficult to go and pull out the sac in its entirety. So often we're used to having to curette and wash out the insides of this cyst. Now often, if the cyst is amenable, you can pack it with a dressing like Aquacel Silver, which helps to maintain some form of cavity there until the tissue heals from the base up. You may remember that from a previous video I described how healing following an infection heals by secondary intention. That means that the healing comes from the base up as opposed to from top down. When you normally cut yourself, you have a small scab and then that heals from the base down. But when something is badly bruised and infected, it's very difficult for it to do that. So it heals from the base up, pushing through all of the debris that we don't want inside. So let's have a look what went on next. Irrigation is a great way of making sure that all of that stuff is washed away. But because this sac was so big and so deep, I felt that if we got a good enough clean out with a washout, we may be able to avoid having to pack it. The only problem with packing is that it takes a lot of time. The bandages have to be changed almost daily, and for a cyst this large, you're talking about 6 to 8 weeks for complete resolution. So it made sense that if we could get away with cleaning and washing and suturing it, we might be able to save a good quality of life for this individual. So when we have a look at the post-operative wound, it looks actually very, very good. We'll go and take a look. So we did this last week, and it was very, very bruised, wasn't it, and inflamed, and it was quite deep. And what we want to do is make sure that it's healing nicely. So we're just going to remove the dressing off. There we go, there's very little in terms of discharge there, which is great, given the size of it. Next we put in 2 stitches in place. So what I want to do is just take those out. 1 and 2, just take those out. Very little has soaked through the dressing, which is very encouraging, and most importantly the wound has closed up and the stitches have come out nicely. The bruising is much more settled and the inflammation and swelling has all but gone. There may well be a little bit of fluid underneath that, but what I want to do is for the body to collect itself, solidify around whatever's remaining inside, and if it causes any problem, we can then go in and remove that hull, completely avoiding the need for packing. So all in all, a controversial video, but actually a fantastic result for this young lady. So remember, if you haven't done so already, comment down below because I read everybody's comments, like and share, and if you aren't a subscriber, subscribe because I know a lot of you aren't subscribing, you're just watching, and for those who are subscribed, remember to press the alert button, turn it into a happy grey medium. So until next time folks, goodbye, bye-bye. There's no pain at all in there.
No, not now.
No. There's a bit of inflammation from where the infection was. There might be just a little bit more fluid in there. We've got an option of draining whatever's inside, or let it just collect and let it shrink a bit, and then open it again. Because what I don't want to do is have to pack you forever and ever, which is a never-ending process. So what I might do is wait, because it was so big, is wait for the body to encapsulate this little bit of fluid. It's not infected, and then in a week or 2, or maybe longer, we can just take that cyst out.
So it's still got stuff in there, is it?
Yeah, still got a bit of fluid in there, I feel. A little bit of fluid. But it's not like an infected fluid, because the skin's looking completely flat. So what we would do is cut it open, drain it and then pack it, but the packing process takes time, and it'd have to be packed every couple of days. Or we could leave it as it is, because it's not infected, wait for the body to shrink it, and then when it's really small, we can then take it out, and that saves us packing like forever and ever, and gives you a bit more quality of life.
Okay, I prefer that,
I'd say just leave it for the time being. Looking very good, very flat, not red, the bruising on the skin will disappear, the wound is looking very clean, and there's no discharge. Very good, very good.